I'm Avery Fuller. I'm going to be your provider today.
Hi,
What's your name?
Caprell.
Hi, Caprell. How are you feeling today?
I'm good. How are you?
I'm good. What brings you in?
To establish myself as a new patient.
Excellent, excellent. So we are glad to have you. I am going to be performing your assessment today. A lot of that is going to entail me asking you to follow some commands, change some positions, and I'm going to be putting my hands on you. Is that okay?
Yes.
Excellent. So I've already washed my hands, introduced myself to the patient, and we're going to start by pointing out a few landmarks, okay?
Okay.
Okay. So first we see the trachea right here, the suprasternal notch. We have our sternum, our right sternal border, our left sternal border. I'm going to be taking a look at her clavicles as well as the angle of Louis, which is where the second rib meets the sternal border on each side. We have our costal angles right here where the ribs delineate from the sternum. And then if I can get you to tuck your chin to your chest real quick. This prominent vertebrae is the C7-T1 vertebrae. Excellent. If I could I get you to kind of lean back on your arms real quick? So just right here, I'm noting no discoloration. She's in no obvious signs of distress, no vascular irregularities, no asymmetrical breathing or use of accessory muscles. So very good. And then if I can get you to just put your arms over your chest real quick. I'm moving to the back, and again, I see no vascular irregularities, no discoloration, no use of accessory muscles, no signs of distress. So Miss Caprell, if I can get you to put your legs right here for me. Excellent. So right now I can see the anterior portion of the chest and the posterior portion of the chest. I note no barrel chest, no trunk chest. She looks just like a healthy 24-year-old. Okay, so I'm going to be palpating right now. This is the palpation portion of the exam, okay? So I am going to be asking you to take some deep breaths for me, and I'm going to be putting my hands on you. You ready? Take a deep breath, and out. And in, and out. Good. In, and out. And take a really big deep breath in, and then just blow it all out. Excellent. Now I'm going to ask you to do the same thing, but I'm going to ask you to say 99. 99. 99, 99, 99. Okay, so I can see that interiorly everything is symmetrical. Her chest rises and falls as it should. I hear no wheezing or stridor just from hearing her breathe. I felt no crepitus, no tactile fremitus, and I'm going to be doing the same thing here. So if you just take a deep breath for me, and out, and in, and out, and in, and out. Great, and in, and out, great. Say 99, 99, 99, 99, 99. And then just take a big deep breath in for me, and out. And once again, no crepitus, no tactile fremitus. Everything is symmetrical and expanding as it should. So that's great. So the next thing I'm going to do is something called percussion. It won't hurt. I'm looking for a resonant sound throughout all of the fields, okay? If you hear a flat sound, then it's most likely the bone. So we're being careful to avoid that. And she does have resonant sounds. And I'm going to do the same thing on the back, okay? We're avoiding the scapula. Once again, we don't want the bone sounds. We want nice resonant sounds, which is exactly what we've got here. So now I'm going to be measuring her diaphragmatic excursion. Miss Caprell, I'm going to ask you to take a big exhale out and hold it. All right, and here we are putting a little mark. We are measuring from the point where our tone and pitch on percussion ends. So if I can get you to take a deep breath in now and hold it. Excellent. So this is about 4 centimeters. You want it about 3 to 5 centimeters. So once again, another expected limit finding. Okay, so right now I'm just going to ask you to breathe normally, and I'm going to look at the rate and the rhythm of your breaths, okay? Beautiful. So she did do 2 breaths for 6 seconds. They were in no distress, no rushing, no shortness of breath. So that would be 20 breaths per minute. Excellent. All right, Miss Kendall, I'm going to be auscultating with the diaphragm on my stethoscope now. I'm going to be asking you to take some really deep breaths and then blowing them right back out. 4 areas anteriorly, 2 areas laterally, and then 6 areas in the back, okay? Take a deep breath. This is 2. Deep breath. 3. 4. 2 areas laterally. Take a deep breath for me. And then I'm going to go to the posterior. Okay, take a deep breath for me. And once again, we are being careful to avoid the scapula. Take a deep breath for me. Take a deep breath for me. That's 3. 4. 5. And 6. All right, excellent, Miss Capral, excellent. So if I can get you to put your legs over here for me. So that concludes our lung portion of the assessment. Now we are going to go to the heart portion of the assessment, okay? So I'm going to identify some of those landmarks again. First we have our trachea, our sternum, right sternal border, left sternal border. Here is our clavicles. Our epigastrium right here is directly below the chest, immediately above the stomach. We have our apex of the heart right down here. It's a little dislodged, displaced due to some breast tissue. And then if you could hold your arms out for me real quick. Great. Here is the axilla area, and it's underneath the armpit, right? It extends toward the breast tissue. Okay, you can relax, my dear. All right, Miss Capral, I'm going to ask for you to lay down with your legs right here and your head over there on the table. Excellent. So once again, we're going to be taking a look at the chest. We're noting no discoloration, no cyanosis, no obvious deformities of the chest right now. I am going to shine a little light over her PMI just to see if anything is out of the ordinary and everything is fine. I see no evidence of scarring or anything like that. So now I'm going to touch your chest, okay? I'm going to palpate your heart. I'm looking for runs, for thrills, for anything that might suggest that the heart is working in a way that it shouldn't be working, okay? And I'm going to count your apical pulse as I palpate it. Excellent, excellent. Okay, I'm going to help you sit up, okay, Ms. Capral? Perfect. Any trouble breathing, any trouble moving, anything like that? No. Okay, excellent. So now I'm going to be auscultating your heart sounds. I'm going to be using the diaphragm and the bell of the stethoscope. And I'm going to be listening for an S1, S2 sound. Those are our normal heart sounds. I'm going to hope that I don't hear any S3, S4 sounds. No galloping, no clicking, no murmurs or anything like that. So I'll be listening with the diaphragm and the bell. If I can get you to lean forward just a little bit. Okay, so I'm going to start listening to the heart on the aortic part of it. This is the second intercostal space, right sternal border. And now we're going to the pulmonic, which is the second intercostal space, left sternal border. Herbs, which is the third intercostal space, left sternal border. Tricuspid, which is the fourth intercostal space, left sternal border. And then the mitral, which is once again displaced by breast tissue in women sometimes, but you can hear it pretty well right here in this position, and it's going to be in the fifth intercostal space, mid-clavicular line. Okay, now I'm going to switch to my diaphragm. This is going to help us hear any murmurs a little bit better. So once again, I'm going over the aorta, the pulmonic, Erb's point, tricuspid, and mitral. And I'm going to take an opportunity here to auscultate the heart rate and the heart rhythm. Excellent, excellent. So I did note that there were S1, S2 sounds, no adventitious heart sounds, no clicking, no anything like that. I did not notice any murmurs, but if I did, I would be looking for timing of the murmur, pitch, quality, tone, pattern, and variation with the respirations. Her heart rate and rhythm was normal, and on auscultation and palpation, they were both 90. I can hear that she doesn't have any wheezing, no stridor, no anything. She's obviously in no distress. Do you have any questions for me?
No.
Excellent. So over the course of the assessment, I have heard her voice and everything, and her air is passing through her vocal cords fine. She does really well speaking. It was very nice to meet you.
You too.
Okay, I hope you continue to come to our practice for your needs. Have a good day.